bone onto the spinous process, and then you applied central PA. You did for L5, L4, L3, L2, and L1. Am I right? Yeah. Now, for unilateral PA, you need to apply it on the articular facet. So when I'm saying articular facet, that means you need to do it on both sides. You need to do it on the side you're standing, which is the left side, and then you need to move around and then do it on the right side. Okay, so the hand position technique is called butterfly hand position. So your thumbs together and then the finger spreads across. So the pads of your thumb comes on contact with the articular facet. So the pads of your thumb comes on to the facet, articular facet. So place, so once you palpate the spinous process, use the reference point to come across to the facet joint. Once you got the location of the facet joint, get into the butterfly hand position, use the fingers to hold the muscles, pull the muscles together, and then apply the PA technique. I'll show you. But I'm just showing you on the articulated spine first, but then I'll show you it on the. Got me? You understand? Okay. We're going to follow the same principle as what we did for central PA. We're going to apply from grade 1 to grade 4, 3 oscillations on each grade. At any particular grade, if symptoms reproduce, we're not going to move on to the next grade. We're going to stop there. You can start from the lower lumbar and progress down to the upper lumbar. So it's important you shouldn't have nails. If you got too much nails, that means you might cause pain to the patient. Just not because of the pain, but it could cut the skin. So right, let's go. If you're palpating L5, I'm going to apply the diagnostic PEVMs on L5 S1 segment, on the left L5 S1 segment, then the first thing I'm going to do is to locate L5. In order to locate L5 coming from the top of the iliac crest, palpate the spinous process. If that's broad and thick, I'm going one level below. If that's sharp and round, then I've reached the L5. Once I reach the L5, then I'm using the reference spine to reach the facet joint. With the reference spine to reach the facet joint is 2 finger breadth away, and it's slightly below the spinous process. You see? And that's the location. So I'm going to apply gentle pressure and feel for the L5 S1 junction. So once I got the location of L5 S1 junction, getting into that kind of butterfly hand position, and then once I'm positioned it proper, then I'm going to explain to the patient. I'm just going to apply grade 1 to grade 4. Yeah. If there's any problem, thumbs down, and if thumbs up, and then if there's no problem, thumbs down. Okay. So clear explanation to the patient. Your fingers spread across to the spine, and then the role of the fingers is to pull the rectus spinae muscle together, and then pull the muscle together, and then once you got that kind of decrease the tension at L5 S1 segment, your shoulder goes on top. You see, and then applying grade 1. Grade 1 was okay.
Yeah.
Grade 2 was okay. Grade 3. Grade 4 is okay?
Yeah.
Grade 4, go to mid-range, small amplitude hitting R2 point. So what I tried, same procedure, same principle, but at grade 2, trying to identify the R1 point, and then at grade 4, trying to identify the R2 point. All right, is it okay? Was it no pain, yeah?
No.
So once you clear the L5 S1 segment of the left facet joint, then once you find L5, go on to L4, and then from L4, the reference point to reach L4, L5 segment is 1 thumb breadth going across. Palpate the facet joint first. Once you palpate the facet joint, use your butterfly hand technique, get into position. The same as the central PA, your shoulder should be above, on top of the facet joint. If I apply that far, the technique is not effective. If I go down, that means I'm hurting my back. So the ideal position is your shoulder should be on top of the articular facet. Coming? So pull the tissues together, going on top, and then apply grade 1, 3 oscillations, grade 2, 3 oscillations, and then grade 3. Is it okay?
Yeah.
and then grade 4 go down to mid-range, and then apply grade 4. You need to be, the only one thing you need to be careful when you're applying unilateral PA. If someone has got tight erector spinae, it might be slightly uncomfortable. So you need to loosen up the muscles first, and then so gently go down, and then apply gentle, and then apply the UPA technique. Once you assess that onto the left side, you need to move on to the other side and then test the right side facet joint. So you should not stand down the left side of the patient and then do the right side. Okay, you need to apply UPA on the side you're standing. You shouldn't try to trying this and then trying to do it on the opposite at the same time. Okay, test all the facet joint of the left, and then you can move on and compare that with the right side. Unaffected side first, and then the affected side after. Least painful segment first, and then to the most painful segment after.
How do you know which one's the most and least painful?
Because you do this after
You've done this.
central PA.
Cool. All right.
It's a good question though. Do you see? Make sense? Right. Again, L1, L3, L5 can ask you to try this.